Strip scars eventually can be treated in two ways. One way is the classic plastic surgery restoration by using a specific plastic surgical technique called the W-plasty in combination with a specific closure of the wound called trichophytic closure, which allows to lessen the scar and make it thinner. However, this is still a plastic surgery technique and will produce a new scar. The other technique is the modern technique of hair restoration called the FUE, Follicular Unit Extraction. In this manner, we can use single hair follicles not to restore the scar actually, rather than hiding it with the hair follicles that are implanted on the scar. In certain cases, we can have a combination of both techniques. For example, in wide scars, we can have a scar reduced with the classical plastic surgery W-plasty technique in combination with FUE implantation so that we can hide the remaining scar. In some cases, where the scars are too many or too wide or the donor area is not sufficient, we can use a non-medical technique called tattoo technique, where we can make small spots of the specific color that the surrounding hair have and cover the scar with tattoo. Let's face it, the best scars to deal with FUE are the scars that are quite thin, so that we can sufficiently cover them without using a huge number of hair follicles. In wider scars, the best solution would be either to try and reduce them with a classic plastic surgery technique like W-plasty, or a combination of both, plastic surgery and FUE technique, so that we don't waste a lot of hair follicles that we need for hair restoration in other areas of our scalp. In scar restoration cases, we can use the same donor area as in any other hair restoration case, meaning the back of our scalp. However, it is wiser, let's say, more prudent to reserve our donor area on the scalp for future hair restoration sessions. And in this way, we can use other areas of our body as deposits to harvest hair follicles. These areas are mainly the face, especially the beard area and the chin, and our body hair, mainly our chest, where we can, in most men, we can have nice, good quality hair follicles harvested and placed in the scar restoration procedure. With the FUE technique, we can expect very high rates of success. Also, in combination with plastic surgery techniques, we can expect a wide scar to become thinner and to be hidden, to be covered substantially with the FUE technique. In this way, a person that suffered from this awkward look of a wide scar in the back of the scalp can now trim the hair shorter, can have a different hair look without worrying that he has a visible scar in the back of his head. Usually, for strip scar restoration, only one session is required. A second session may be required in specific cases where either we deal with multiple scars that cannot be dealt with in the same session, or we have a very wide scar and very high expectations where it is more wise to work in steps. So a second session may be required. With FUE procedure, we can deal with cases that we had no other way in the past, especially cases of scars in the eyebrow, either from trauma or burn, an accident, or congenital absence of hair. Also, in cases of surgery in the face, in the upper lip or in the chin, where we can implant hair to cover this small scar, and I may even say, in rare cases, even in other parts of the body. For example, we have performed a scar restoration with FUE technique in a 45-year-old man that had underwent gynecomastia procedure 20 years ago, and he was desperate to cover the existing scars on his breasts. and we succeeded with the FUE procedure to accomplish this.